All right, let's talk about treating lazy eye, or amblyopia. Now, when you picture that, you probably think of a kid with an eye patch, right? But what if I told you there's another method, one that's just as powerful, but works by blurring vision instead of blocking it? Today, we are taking a much clearer look at a treatment called penalization.
For any parent who's been through this, you know the struggle. I mean, the daily arguments, the tears, the patch that magically ends up stuck to the dog instead of on your kid's eye, it can be absolutely exhausting. Well, the good news is, patching isn't the only game in town.
So, here's the plan for our explainer. We're going to start with why patching can be such a headache. Then we'll introduce this kind of clever alternative, this blurry solution. We'll break down exactly how it works, look at when doctors actually use it, check out the surprising results from the studies, and then finally, see how it all fits into the complete treatment plan.
Okay, so before we can really appreciate the solution, we've got to get a good handle on the problem itself. Not just the medical condition, but the real-world challenges of its most common treatment.
First things first, what exactly is amblyopia? Here's the key, it's not that the eye itself is lazy, it's actually a brain thing. The brain, for one reason or another, decides it prefers one eye over the other, and it starts to ignore the signals from that weaker eye. So even with perfect glasses, the vision just doesn't develop properly. The whole goal of treatment is to basically retrain the brain.
So the classic way to do this is called occlusion therapy. You just patch the strong eye to force the brain to start listening to the weaker one. And look, it makes total sense on paper, but in the real world, it can be so tough. Kids just, well, they hate wearing the patch. That leads to what doctors call non-compliance. And let's be real, for a kid trying to fit in at school, wearing a patch can create some serious social and emotional hurdles.
And that, right there, brings us to the heart of our topic today, a really elegant alternative that comes at the same problem from a totally different angle. So, what in the world is penalization? Well, instead of completely blocking the good eye's vision with a patch, you just strategically blur it. You penalize that good eye just enough so that the brain basically says, okay, fine, I can't see well with this one, I'll switch over to the other one. It's a much more subtle but really powerful way to get the brain to do the work.
Okay, so this sounds pretty cool, but how do you actually do it? How do you create this perfect therapeutic blur? Well, there are two main ways doctors go about it. One uses eye drops and the other uses special lenses. Let's break them down.
So on one side, you've got the drug approach, which almost always means atropine eye drops. These drops temporarily paralyze the little focusing muscle in the good eye, and that makes anything up close, like a book or a screen, super blurry. And you gotta love this note here. It's difficult for a child to thwart, because once that drop is in, it's in. No cheating. On the other side, you have the optical method. This is all about using lenses to create that blur, or fog. Could be a special lens in their glasses, a specific type of contact lens, or even these cool frosted films that just stick right onto their regular glasses.
And this is where it gets really, really clever. It's not just a one-size-fits-all blur. This treatment is incredibly precise. With near penalization, you can rig it so the lazy eye has to take over for things like reading or doing homework. With far-point penalization, you can flip it and make that eye do the work for seeing things far away, like the board in class. And in some specific cases, you can go for total penalization, where the amblyopic eye is doing all the heavy lifting all the time. The point is, this is a highly customizable therapy.
All right, so with all these options, when does a doctor actually decide, yep, penalization is the right call here? Well, there are some pretty clear scenarios where this treatment really is the star of the show. Penalization really comes in handy in a few key situations. Probably the number one reason is when patching just isn't working out, maybe because of that daily battle, or sometimes it's as simple as an allergic reaction to the patch's sticky stuff. But it's also the go-to treatment for some related conditions, like latent nystagmus, where actually covering an eye is a bad idea. Beyond that, doctors use it to help maintain the vision improvement after a kid is done with patching, and the data shows it works especially well for those mild to moderate cases of amblyopia. Okay, this is the big one, isn't it? It's a neat idea, it's definitely easier on the family, but does it actually work as well as the old standby, patching? Well, the research on this is surprisingly clear. 3 lines, that's what we're talking about. On a standard eye chart, kids who used either atropine drops or a patch saw an average improvement of 3 lines. Now, to put that into perspective, that can be the difference between seeing a street sign as a blurry mess and being able to read it clearly. It is a massive, life-changing improvement. So when you put these two treatments head-to-head in the studies, the results are pretty shocking. The amount of vision improvement over 6 months? Basically the same. The final outcome after all is said and done? Essentially equal.
The only tiny difference is that sometimes the kids using atropine take a little bit longer to get to their best possible vision. But, and this is the important part, they get to the exact same destination.
And then there's this. This quote from one of the big studies just says it all, doesn't it? There was a slight preference by the child and family for the atropine treatment. I mean, come on. When you've got two treatments that work equally well, but one of them causes less stress, fewer fights, and is just easier on the whole family, that is a huge, huge win.
Now, it is really important to understand that penalization usually isn't the very first thing a doctor tries. It's one very powerful tool that's part of a bigger step-by-step approach to treatment.
So let's just walk through a typical treatment plan. Step 1 is always getting the right glasses or contacts. Sometimes, just giving the brain a clear image is enough to get it to start using both eyes. But if after about 4 or 5 months the vision still isn't where it needs to be, you move to step 2, passive therapy. And this is where you'd start either patching or penalization. And finally, step 3 often brings in active vision therapy, which is like physical therapy for the eyes and brain.
But of course, we have to be responsible here. This is a medical treatment, and it's not something you mess around with. It absolutely requires careful monitoring by a doctor. Atropine is a serious drug. It has potential side effects. And in really rare cases, especially with little kids under 3, it's actually possible for the good eye to lose some vision. This is exactly why a professional has to be in charge every step of the way.
So what's the big takeaway here? Well, penalization shows us that sometimes the best solution to a complex brain problem isn't a sledgehammer, it's a gentle, persistent nudge. It's just an amazing testament to how flexible and adaptable our brains really are. And it really makes you wonder, if just blurring our vision a little bit can literally rewire how we see the world, what other big puzzles of human perception are out there just waiting for their own version of a blurry solution?